Dr. Shalini, let's look at the importance of hormones when it comes to medical conditions like erectile dysfunction.
Right. Asha, just to let you know, many times people, when they come with erectile dysfunction, they often question, is something wrong with my hormones, which is testosterone? Do I have a low testosterone? Many times when we screen them, they actually have normal testosterone level. But this is the time when we picked up many medical conditions like cardiovascular disease, be it heart disease or diabetes, right? Presenting first initially with erectile dysfunction. However, having said that, many of my diabetes patients actually are too shy to admit that they have this issue of erectile dysfunction or impotence, that we usually call them. Um, the thing about diabetes with ED is that it's quite common. It's about 30 to 90% prevalence. And the thing is, some of them have it as early as 10 years earlier than someone without diabetes. So we do see erectile dysfunction in the elderly. As you age. Things like ED will occur. But with diabetes, with people living with diabetes, this issue comes out earlier.
Right.
And I must admit, as doctors, sometimes it's very hard for us because it's quite personal to actually get the patients to bring it up. And some of it are brought up by the partners instead of the patients themselves. Okay.
Right. That's very interesting, actually, because we've been sort of wondering about how this affects relationships and stuff.
Correct,
And the fact that you say that you know, partners bring it up is quite good. So what you're saying is that basically sort of seeing diabetes come up earlier could be something that you could warn the men about in terms of what possibly might come up as a result of having diabetes. Is that right?
Yes, yes. So because it's also a warning sign that, because erectile dysfunction is due to, majority is due to impairment of blood flow to the penis. So what happens is that you need the rush of blood through the penis during a sexual intercourse. So erectile dysfunction is basically inability to achieve, maintain, and sustain an adequate erection for sexual intercourse. So when this happens, what can happen is that the man would feel embarrassed to even initiate sexual intercourse because they have this issue. And the ladies will feel, or the partner will feel, that they are unwanted, undesired, and probably not attractive anymore. So it causes a lot of marital issues. And of course, patients are a bit shy to come and confess, there's issue in my marriage and it's all boiled down because of this issue. And and for us doctors, right, if we do not bring it up, I don't think many of the patients will ask. So now, as an endocrinologist, one of the important things that we need to do is screen our patients for erectile dysfunction.
Right. And initiate the conversation, right?
Yes.
Okay. Yes. So, there's lots of different, what doctors call comorbidities, right? Like diabetes and stuff that we've learned could be the reason why erectile dysfunction is happening. But let's look at hormones, because you're an endocrinologist, right?
Yes.
Can you explain to us the sort of importance or relevance of hormones in this equation and how that affects ED?
Right. So most important question patients will ask is my testosterone level adequate? Because this is the first thing that comes down, because it's that if I have lack of testosterone, then I'm interested to get on testosterone and at least cure my problem and get on with life. But what we usually ask, we don't routinely do testosterone as the first line of ED beforehand, because there are a series of questions that we usually have to ask our patients. Like, what are the symptoms of hypotestosterone? Hypo meaning low testosterone. So usually they not only have erectile dysfunction, what they could have is that they'll probably lose muscle mass. Instead of muscle, they're building up more fat. Other than that, low mood, feeling depressed, lack of focus and concentration, no morning erection, and also less facial hair. So they probably shave less frequently. So these are the signs. And they will also tell you that, I don't really have sexual desires. besides the fact that they have ED, they will probably say, I don't even have the desire to have sex. So things like this would probably be the accompanying symptoms of low T. So low T is short for testosterone.
So when it's low testosterone for a man, does that mean their estrogen level? Because forgive me, because I when it comes to hormones, I only know two hormones.
Right.
It's testosterone for men and estrogen for women. And we always hear like, if your testosterone levels are going down, maybe your estrogen levels are going up. Is that how it works?
No. So basically what happens in a man is that some of the small percentage of the testosterone is converted to estrogen, but that is probably just for beneficial for bone health rather than, giving them a feminine features and things like that. So people with low testosterone don't usually have, female characteristics. You just lose their manliness in the sense that muscle mass loss, they get more fatter, they don't look as masculine as they should. Yeah, but it's not that estrogen is going up. No, it's just that the testosterone are low, and that we need to investigate what's the cause of the low testosterone. And the causes are many, and I could just categorize them whether it's primary or secondary. Primary meaning that means the problem is usually due to the testicular dysfunction. That means the source of testosterone is usually produced from the testis. All right. So then we will ask things like any trauma to the testis, any infection in the testicular gland, and things like that. It can be a congenital cause that probably he has have a congenital issue where the testis is not functioning adequately. And other than that, is that any trauma, any procedures done that probably has traumatized the testis to a certain extent. But majority of the low testosterone is due to a secondary cause. So in our body, there is the system we call hypothalamus pituitary gonadal axis. So,
what? Is there a short form for that?
Pituitary? So, hypothalamus pituitary what?
And gonadal axis.
All right, okay.
So this is the axis that regulates the production of testosterone. All right, so there is a stimulus from the in the brain. So hypothalamus and pituitary are located in the brain. They are the one that releases certain hormones that trigger the testes to produce testosterone.
Right.
So pituitary being a master gland, there is two hormones that it's usually will release, which is luteinizing hormone and follicular stimulating hormone. So the luteinizing hormone will cause the testes to produce testosterone, as the follicular stimulating hormones, for short we call FSH, will stimulate the testes to produce sperm. So this is regulated in the body. So anything that affects the brain will definitely affect the hormones that it releases to stimulate the testes to produce.
Right. So the one in the brain is a switch.
Yes, it's a switch.
Testes to produce.
Yeah. Produce more, to stop producing, all that kind of stuff. Well, that's fascinating. Okay. So first of all, before we go any further, how many hormones do we have in our body? How many hormones does the body produce?
That is so many hormones. All right, the hormone pancreas, which produces insulin, is also a hormone that causes lack of these hormones, causes diabetes. All right, so if you talk about the pituitary, which is the master gland, it's there are many hormones that it controls. Right, it's like a master gland. It controls the thyroid gland. It controls the sex hormones, the growth hormones, and even the hormones that for a breastfeeding mother to lactate, we call it prolactin, is from that pituitary gland. There's also another hormone we call antidiuretic hormones. The hormones that helps us to concentrate our urine are also produced from this part of the brain. Yeah.
Wait. So in summary, just like how many altogether, how many hormones do we have flying around our body that are doing really important things?
I can't recall offhand, but
that means there's a lot.
There's a lot. There's like 50, 100.
The adrenal glands produces the stress hormones, adrenaline or epinephrine.
Yeah, my adrenals are shot.
Right.
Yeah. So I know all about that.
And of course, that's a famous hormone that makes everyone happy, right? What's that happy hormone?
Oxytocin.
Yeah.
Serotonin, dopamine, and things like that. Yes.
Okay. Right. So basically, from what I understand, is ED could be caused by low levels of testosterone. However, low levels of testosterone need to be investigated because it could be injury to the actual site of the testes where it happens. It could be something that's happening in the brain. It could be as a result of too much excessive something else that's causing a low production. So it's I'm now getting confused once I go past that point.
All right. So another important thing besides the brain, that's the master glands that helps with the stimulation of the testes to produce the testosterone. There are other reasons why the testes might not be or stop producing testosterone. For example, if a patient who is chronically using painkillers, we call it opioids especially, this in the long term will stop the stimulation of testosterone by the testes through the brain. All right. And other things, if you are taking testosterone exogenously, meaning that you are consuming it or, either injecting testosterone for, this is quite common among muscle builders or men who wants to feel, who wants to look good, muscular. So sometimes in the process of wanting to build that muscles, they might be taking, by promotion by people, say you will hasten or fasten your muscle building. So they might be abusing this for quite some time, some even many years. And once the moment they stopped it, they go into a shutdown where the testis is just, because there's no much stimulation from the brain to produce it, it just goes sleeping, hibernate
So
for a while.
basically, when you say pumping in extra testosterone, are you talking about steroids here?
Yeah, so this is the layman's terms or anabolic steroids, which we usually known as testosterone, synthetic testosterone. So they are pumping in these steroids to look good and things like that. But what it does is shut down the system's own ability to produce testosterone.
Okay.
Right. So can that be remedied easily? Like if that was the cause of it, if you just was to stop injecting, would everything go back to normal?
Right, that is a challenge here. So if you have been taking it long term, what happens, like I've said, the system goes into a sleeping mode or suppression mode. So this is when the patient may or the individual may actually experience a withdrawal symptoms. Like you've been taking or depending on this medication for so long. So you have that feel good feeling, your moods are up, you're very energetic, your drive is, you're on the go, and suddenly you stop it. So the reason for stopping it is because, one, you don't need the testosterone when you have adequate testosterone in your body. Probably what you need is actually just more muscle training, exercises, weightlifting. So why we need to stop this is that it will stop the testicular ability to produce sperm. All right. So what happens that if you chronically on a long term using this testosterone, it affects the sperm count. So it causes infertility in the long term. The testis, in fact, will go to a shrinkage. So you have smaller testicular size. When you on the long term, you use this. So we don't want the patient to use it. One, is not safe. Another reason is because it affects the fertility. And a young man using these steroids, like you said, on the long term, it will definitely affect their fertility. Okay, and sometimes it's irreversible. So that's one important thing to highlight. Yeah.
Is there anything else like that that's outside of you that also affects your testosterone levels or could cause ED?
Right. So I would like just to highlight the fact that certain patients who are morbidly obese can have low testosterone. All right. So it affects the total testosterone, and sometimes the treatment for this low testosterone in an overweight or obese individual is actually to encourage them or even to treat their obesity, and then the testosterone will return to normal.
Okay. So in other issues where testosterone is low because of other things, whether it's diabetes or obesity, is it standard to sort of attack that part first or concurrently with medication to treat ED?
So there are a series of investigations. First, like I've mentioned earlier, we have to know whether it's a primary problem or a secondary problem. The secondary problem, there are many. So main bulk being diabetes, cardiovascular disease, or obesity, or even psychological stress. So you can imagine when you are in chronically stressful state, be it emotional stress or physical stress of an illness, you will definitely have a lower testosterone. Because it's like in females, when you stress, sometimes you miss your periods, right? So that happens in a man. So your testosterone goes low when you are chronically stressed.
Okay.
Yeah. So it's a very volatile hormone as well. Moods and emotions affects the level. So even if when we were to diagnose low testosterone, we usually do it in the morning in a fasting state. And if it's low on one reading, we usually need to confirm that with a second reading. And 2 readings of low will then confirm, yes, you have low testosterone. So we don't do just a random testosterone, and if it's low, we say, yeah, you have low testosterone. We have to confirm it, and ideally it would be in the morning, because that's when testosterone is supposed to be highest.
Right. And that's why in the morning...
You have an erection, yes. Yeah.
Right, okay. So, I mean, are all these things detectable by a blood test? I mean, what can our blood tests show that might indicate we have ED, or we could be looking at having ED as a result of X, Y, and Z?
All right. So ED is usually a clinical diagnosis. So if patients tells you, I'm unable to have an erection or sustain an erection, and we have questions to ask together with that, how the erection is, and then after that, we will look at the comorbidities, what the patient already have. And mind you, a lot of medications actually does cause erectile dysfunction. All right, there are a list of antihypertensive medications, blood pressure medications, antidepressants, and also some psychiatric medications, and a bit of cholesterol medications. Not many of them, but may cause ED. And this is something that our patient have to tell us, ever since you started me on this medication, I have inability to achieve an erection. All right.
Wow, that's so interesting. Of course, is this something that doctors would be talking about in terms of the medicines that could, I'm looking at JD's face here. He's furiously thinking about all of this information you're giving him. But, if a doctor were to prescribe a certain medication that you knew had a side effect that was likely to cause some level of suboptimal erection, for example, would this be something that a patient should be warned about, or do you wait for them to come to you?
Right. So because the incidence is very low and we do want our patients to take the medication, it's unlikely for a doctor to routinely warn the patient. But usually what the doctors does, and the second follow-up, any problems with the medication, and that's when the questions about ED might pop up.
Right.
Yeah, but having said that, yes, I think the doctors should be aware that if the patients already have an ED and you add on a medication might worsen it, I think it's the responsibility of the doctors to actually tell the patient, this might worsen your ED and things like that. But having said that, a lot of our patients actually have ED, just not properly treated or acknowledged and managed. And when we give a medication, it worsens things, then the issues are brought up, and then only it gets treated and addressed.
So at present, that means I can't rock up to my doctor, my GP or someone. Could you take some blood from me? I just want to see whether there's something wrong with my blood hormone levels, because I might have ED. You can't tell from a blood test.
Oh, okay. So if you have ED, then just have to tell the doctors, I have erectile dysfunction and I'm interested to know what's the cause of it. And then one of the investigation would be a hormonal test.
All right. The opposite of that would be a doctor takes my blood test. From that blood test, could the doctor say, well, based on this test, I think you're on the verge of getting ED? Is that possible?
Right. So usually testosterone is not a routine test for even a medical checkup. We don't routinely order. So there are criteria to order a testosterone. First of all, if all the symptoms of low testosterone is there, including ED, then we will only do that test. Okay. Right. But unless you have the suspicion or anybody have the suspicion, I think my testosterone is low because I have, lack of sexual desire, I'm losing my muscle, losing my mood, I'm depressed, I'm losing my focus, things like that, then the doctor will definitely help you to just you know, test it and see whether it's indeed is low.
Right.
Yeah.
So you have to opt in for that option.
I think that's a really good point you brought up, JD, that for any men out there, because you might not notice, you might just think, oh, I'm getting middle-aged spread, I'm just getting a bit softer. You might not even realize you're shaving less. Like men, you know, you said lose a muscle mass and sort of get a bit of fat on, you know, I'm eating too much, you know, ghee, for example.
It's just getting older.
You know, getting older, yeah. So I think that, you know, for all the men listening to this and all the women who are close to the men listening to this, if there's sort of changes to sort of kind of go, oh, actually, I might pop to the doctors and I might actually ask, even if I can't talk about ED, I might ask for my hormones to be checked. I might just go, can I just check my testosterone
Is that possible?
levels?
Is that like, I'm going for a blood test, I would like to get it checked as well?
Yes, you're right to get it, but probably not in a government hospital where everything is subsidized. If you want, you can go to the GP and any doctors in the private facilities to get it checked, even to the private labs to get it checked. Yeah, it can be done.
Okay. Awesome. So what would be the best treatment plan using hormones or hormone sort of therapy for ED?
All right. So once we confirm that is an issue with low testosterone, then we will investigate the root cause of it, whether it's due to a physiological cause or the underlying medical issues, then we'll address that. And if we can't, we probably can replace testosterone by either, you know, there are many forms of replacements of testosterone. It can be in the form of a gel, a patch, oral.
These are the HRTs, right?
Yeah, we call it HRTs for men. Intramuscular injections, and also there are also some pellets where you put it under your skin. That are the many forms of testosterone.
When you say intramuscular injection,
JD's like cringing over here.
I'm very concerned about asking this. Where do you inject?
Buttocks.
Yeah, buttocks. Yeah, you can even,
I think JD was worried that it would be injections into the site that was experiencing the problems. Yeah. Okay.
Yes. But for erectile dysfunction, some we treat it. First of all, let me just highlight that erectile dysfunction, it's not all due to low testosterone. First and foremost, I think majority, in fact, about 40% of it is due to underlying hypertension, cardiovascular disease, heart disease, contributed by smoking, alcohol, high cholesterol levels. And this is usually, it's not that easy to treat. We treat the hypertension, we treat the comorbidities, but you still don't have an erection. So what can be helped is that you actually help with medications like, which is essentially a PDE5 inhibitor. What happens is that if you rule out any contraindications to medications like Viagra, we can choose things like Viagra, Cialis first.
So, doctor, if you don't mind, I'm so sorry to cut you off. Could you not say Viagra and say maybe the blue pill?
Yes,
it's
can.
right?
Because
it's
branding. Can.
So could you say that again? Start again and just say the blue pill.
The blue pill, yes, the blue pill, and or a better term, the PDE5 inhibitors, which is an oral medication to treat ED.
Okay. So that comes in a pill or liquid form?
Yes, a pill form, yeah.
Pill form. And do you take that for the rest of your life, or does taking that actually help you get back on the horse, as it were, and then start being able to be fine without it?
Spur production in a way.
Yes.
Ideally we like to treat the underlying cause rather than give a medication that gives erection. But as long as we can't treat the underlying cause, it's not that easy to treat the underlying cause. We can support the patient to have a better quality of life with these pills.
Okay.
Right, I see.
So like the sort of the other HRTs, are they similar to what women get in terms of like creams and stuff that you just rub on your skin sort of every day?
Yes. So we have the cream form of testosterone. I wouldn't name the brands again. That there are a few of them out there which we can use. It's quite so the cream forms is quite safe as compared to the intramuscular or the oral form, which might cause other systemic complications of synthetic testosterone. So the easier ones would be the application type.
Right. Or so basically don't start with the strongest one, basically, which is the injection. Try the milder ones. Is that what you're basically saying in a way?
Right. The milder, I wouldn't say that it's a milder form. It's just an easier way of administrating. As you know, intramuscular injection is cumbersome for the patient. They might not like the injection. They might dread going to the clinic to get the routine injections.
It's like having a horse bite on your buttock. Yeah.
Okay.
Yeah, but there are some intramuscular that last about 2 to 3 months. Yeah, just one jab. So things are getting better. People are improving the delivery and duration of action of medication these days.
Right.
And you said under the skin. Are you talking about implants as well?
Yeah,
like
implants as well.
Okay.
It's called pellets.
How long do they last?
I think about a month, or 3 months, depending on the brand again. Yeah.
Okay. So basically, it's not always like ED is really just the effect of something else. Is the result of something else that's going on in your body. So it's a cause and effect thing. Okay, cool. I got that part.
So
then.
the ED is basically a vascular or nerve issues.
Okay.
Yeah, and the hormone thing gives you other things besides the ED. So it's like ED is one of the manifestation of low testosterone. Yeah.
Okay.
When it comes to sort of the hormones in our body and them going out of whack that cause a sort of a cascade of different things, is there any way that we could change how we live or do things that would help our pituitary gland and all the other, our pancreas and everything, do what it's supposed to do? Or are there things that we shouldn't be doing, which are actually causing these problems, that we could adjust so that we can, especially with men, can focus on those areas as well as medication and what's actually happening?
Right. So if you are trying to maintain a good sexual life and good hormones and things like that, obviously, first and foremost, like any recommendation is healthy living. Try to avoid exercise.
I try to avoid exercise all the time. Yes.
Try to avoid excessive alcohol, smoking, narcotic drugs. Being dependent. Any drugs, as a matter of fact, pain, opioids, and things like that will really ruin the system. And the regulation of normal balance hormone levels. Obviously, what is more common is your comorbidities, avoiding your risk of developing obesity, diabetes, high cholesterol, all contributes to this as well. And also another important thing that we should try to address is mental health, right? So mental health affects a lot of your hormones as well, especially when the sexual function and the hormones. So when you are psychologically or emotionally stressed, I would definitely see a slightly low level of testosterone. Okay, like if we are doing a test on the testosterone level and people in ICU, we are not surprised if it's low, because they are under such stress, and it's going to be low. It's not because there is testicular failure and things like that. It's just that it's because the body is under stress. When body is under stress, many of the hormones will be low due to a defense mechanism in the body. Yeah.
And earlier you were saying also that sometimes hormones out of whack can actually make you feel down and have the blues, which then can also exacerbate the problem. Is that correct?
True. Yes.
Right.
Okay. If you don't mind me asking, so let's say I fix my lifestyle and I'm trying to live clean and I live a pretty good lifestyle. I exercise. Just want to get your thoughts on this, doctor. There are certain foods that you eat that is famous for helping you, like if you take oysters, let's just say it helps, or if you like when you're driving around KL and then you get to the traffic lights and then you see a little sign that says it helps men.
Herbal drinks,
herbal
drinks,
exactly.
you're talking about. Okay.
We hear so many we have so many different kinds of drinks and superfoods that help with our virility. How true are these miracle cures?
Right. I wouldn't say they're miracle cures. Like oyster, for example, is rich in zinc. Right. Zinc is part of helps with the production of testosterone. So not only zinc, you can have a lot of green vegetables that are rich in zinc, red meats and salmons, and also nuts, and even chickpeas, and a lot of I would say grains have zinc. So eating all these will also help in the production of testosterone. Yeah, so there are we call it the superfood for good testosterone level, which is rich in zinc mainly. things like vegetables, like tomatoes, for example, has been said to improve blood flow generally. So we assume that it can also help blood flow down there and things like that, you know.
What about those drinks then?
Those drinks,
The
if you're
made
talking
from
about
roots, made
Yeah,
from
made from
roots,
roots.
like magical sort of
like
roots.
is
Yeah.
it? All right.
Yeah.
So yeah. So if you are depending on, I mean, you're hoping that Tongkat Ali will treat ED. I'm yet to actually see a success story. But what is known that Tongkat Ali actually helps with the testosterone level to a certain extent. And the thing is that many people are start using this thing so-called herbal, and they might actually put in something else there that actually contains testosterone, and and then, you know, market it as it's just purely that. And that's what we need to regulate and ascertain. So if the patient or anybody comes to us and say, I'm taking this pill, supposed to help my ED, what do you think of it? Many times we are not aware of what it contains, and we can't answer the question of
that's the thing with these herbal tinctures and stuff. Unless they completely list out everything in there and the percentages, it's
And they haven't
hard,
been
right?
clinically tested as well. Most of these, right?
I think there's a lot of medical papers that I've, because of as a result of this topic, read where there are tests and stuff done, but they're done with, you know, it's measured doses and it's scientific and it's specific stuff. But, you know, who knows what Patjeet puts in his iced beverage down the road, you know.
That's true, yeah. All right.
Or the amount of sugar he puts in it as well.
But oysters,
yeah, I think so. I don't know.
So if you're on a budget, though, spinach can work as well as broccoli. That's what the doctor says. So if you can't afford oysters, go for kangkong.
Yeah, okay. And the nuts. Yeah.
Doctor, overarching everything, and you've given so much amazing insight to both of us here today. I've seen sort of JD just like going, wow.
I didn't even know there were so many hormones as well. Yeah.
All right. What would be your advice to men who are experiencing either a downturn in desire part or actually experiencing ED itself? What would be your advice to those men or their partners?
All right. So first and foremost, we doctors are interested in the body. So we would like to see anything wrong with the body in terms of cardiovascular disease, be it diabetes, be it hypertension, smoking long term, alcohol too much, and then we'll look into hormones, and then we'll address accordingly. All right. So first, I just like to highlight that if a patient have erectile dysfunction, another thing to screen is how is the heart getting on. If any poor flow to the down there, we might suspect poor flow even to the heart. So that's one of the reasons when the patient have ED, do a heart screening, for especially if they are diabetes, because diabetes is a high risk factor for cardiovascular disease. And we usually do all this routine testing to look at the cholesterol, look at the sugar, look at the BP, and then look at the heart, and then we see whether this ED is due to all this. And then at the same time, we can do a hormone level. And maybe it's probably a psychological issues going on, being stressful lifestyle, COVID situation, not getting better and things like that. So there are many factors that can cause ED, you see. And of course, medications to look through what are they on, and then come to a diagnosis, what's the cause of the ED, and then treat it accordingly. And ED can be treated, all right? I've told you the medications, and sometimes if medications fail, there are devices or injections and things that can help with the achieving an erection. So it can be treated. It's just that you have to come forward to tell the doctors, I'm struggling with this, I don't like it, I'm not happy with it, my wife is not happy, it's ruining our marriage, let's do something, doctor. So, you know, these are the things that we would, obviously I would, if it is beyond me, I would refer the patient to a urologist to help me with it, yeah.
But it doesn't have to start with a urologist, it can be your GP even.
Yeah, but most of them will see a urologist first, yeah. And then the other things, the comorbidities will come up at the same time, yeah.